Testing 1, 2, 3. Testing 1, 2, 3.
Mm.
Good afternoon, fellow Rotarians and guests. Great, thank you. Good afternoon, fellow Rotarians and guests, and welcome to this July 27th meeting of the Rotary Club of West Jacksonville. If you would please rise as you are able and join us for the invocation to be given by Father Mark Eldridge and the pledge by Ron Roberts.
Yeah. All right. Well, I don't know if I'll do that, but I'll continue. I got the preacher's got the microphone, so I can keep going. No problem. But Father, again, we thank you for this opportunity to serve you. We pray that our club would serve others above self, and imagine how we can do that better this year. Bless our meeting today, our speaker, and we thank you for the food that we just ate. In your name we pray. Amen.
Amen.
United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Great, thank you so much. If you are joining us by Zoom today, which I'm happy to see PDG Jerry McCool, Alton Yates, Judy Matheny, I muted myself. My husband would be thrilled. He loves it when I mute myself. He'd like to have a permanent mute button for me. But if you're joining us by Zoom, and I mentioned that we've got several folks joining us today, great to see that Ed Pratt Daniels has joined us. Judy Matheny, Alton Yates, good to see you. PDG Jerry, I think I saw Judy Matheny on there. Great to have y'all with us, but if you're joining us by Zoom, please mute yourself. But do feel free to participate in the meeting by submitting any questions or comments by the chat feature. Thank you, Mark and Ron, for participating in the meeting today. Thank you also to Marshall Butler for being a greeter today. And thank you all for joining us. We're glad you're with us. And I'm joining you from Asheville, North Carolina, and I'm looking out over the mountains out here. And I can tell you that looks a little different than the St. Johns River. but it's beautiful and in its own way. I hope that it's a beautiful day there on the banks of the St. Johns River, and I hope you're all having a great day. A few pop-ups for you today. Just a reminder that the Rotary Leadership Institute will be on August the 6th, and you can sign up in DAC-DB for that. And that the Vibrant Club Seminar will be on August the 20th, and that you can also sign up via DAC-DB for that. There are committee sign-up sheets on each of the tables, and I want to thank Patty for getting those ready for us. So please take a look at those and volunteer your time and talents to one or more of the committees. And if you see that a committee chair spot is not yet occupied, please feel free to volunteer for that. Our directors are still working on those, and some of those, if you see that it's blank, it just means that that name was not confirmed when we went to press on those sheets. But do please feel free to volunteer, or as one of our directors said, you might be voluntold. So please feel free to volunteer and participate in your club, because you really do get more out of the club the more you participate in it. So those are there for your volunteerism. So last on my list of pop-ups is we will be having a social on August the 9th instead of a meeting, and more details will follow on that next week. I'm not aware of any other pop-ups. Are there any from the audience that I'm not aware of before we move on to a special presentation?
Thanks, President Sean. Yes, we do have a very special pop-up today. Ken Baker and Ken Baker and Joe Springer, our past and present foundation chair, will be presenting the awards.
Thank you.
John, could you and your two grandchildren come up, please? That's good. Yeah, Joe and I are very honored today to help with the presentation of the Paul Harris Fellowship Award to Barley and to Joseph. About that. Better? Joseph and Barley are receiving Paul Harris Fellowship Awards today. This award is named for Paul Harris, who is the founder of Rotary. It is the highest award that the foundation gives an individual. John is a major donor. You're among the top contributors to the Rotary Foundation and our club. Thank you. Your contributions to the Rotary Foundation are transformed into grants that fund local and international projects that promote peace, fight disease, provide clean drinking water, save mothers and children, support education, and grow local economies. You give knowing that you will not get a thank you from the recipient, because that person does not know that you're helping them have a better life. That is the true meaning of giving. But I wish to thank you on their behalf for empowering Rotary clubs to take actions to create positive change in their communities like ours and the world. The child who sat in his wheelchair watching the other kids play baseball was not able to play because he had a disabling disease. But thanks to our club and gifts to the Rotary Foundation that helped support it, we built the Field of Dreams, and now that child is out there playing baseball. And I wish to thank you on behalf of the girl in Nigeria who took the polio vaccine that kept her from crawling around in the dirt the rest of her life, because she was immune from the polio virus, because your contribution helped purchase that vaccine, John. When Rotary began the polio eradication program, there were 1,000 cases every single day. So far this year, there have only been 13. The Rotary Foundation has provided to the people of Ukraine by granting over $15 million so far for food, water, shelter, and medical supplies and clothing through the Rotary clubs in Ukraine. Thank you, John, for your generous support to make our world a better place. And Barley and Joseph, congratulations on receiving the Paul Harris Foundation Award. John, can I give the mic to you for a sec?
I asked to say a few words because someone who's not here, but I believe is on the Zoom call, Jerry McCool. Jerry is really a neat guy, and some of you young folks may have not had the opportunity to meet Jerry. Mimi and I were at a function for Rotary, in fact, at this club some years ago, and we were sitting with Jerry and his wife, Jeannie, and talking about the wonderful things that the foundation does. And we began to banter back and forth about who's going to support it the most. And I said, well, Jerry, I tell you what, I'll give one to every member of my immediate family. And he smiled and says, go for it. So today you're looking at number 12 and number 13. And so since I've become something of a storyteller, I would say with a smile that I would hope that you would consider how you might recognize one of your loved ones and help the foundation to continue to do the wonderful work it does. Thank you.
Thank you so much, PDG Ken, Joe, John, Barley. Thank you so much. And congratulations, Joseph and Barley. Thank you, John. That's just wonderful. And thank you for all you do for and through Rotary. A special thank you today to our Sergeant at Arms, Carter Rosenblatt, who is pinch hitting for quite a few of us. So Carter, thank you, thank you, thank you. I owe you, several of us owe you today. So with that, I'm going to ask Carter to come forward and introduce he's going to wear several hats. He's going to introduce our guests and visiting Rotarians, maybe give us a little bit of Rotary history, and then turn it over to the speaker. So with that, take it away, Carter.
Thank you, President Sean. I'd like to start. I know everybody loves me to come up here and tell what my kids call terrible dad jokes. But this week we're going to change it up just a tiny bit. And we thought it would be a great idea to talk about the founder of Rotary, Paul Harris. There's a biography out about him now, which tells a lot of interesting stories. He was quite the rascal and got into a lot of trouble and also did a lot of good. And I thought before we get into some of these funny short stories and interesting facts about him, it would probably be a good idea to start and just talk about Paul Harris, who he is and what he did, and give everybody just a full idea of what he did. So Paul Harris, he was Rotary's founder. He was born on April 19th, 1868 in Racine, Wisconsin. And at the age of 3, he moved to Wallingford, Vermont, where he grew up in the care of his paternal grandparents. He attended the University of Vermont and Princeton University and received his law degree from the University of Iowa.
We missed it.
In 1891. In 1896, Harris settled in Chicago and opened a law practice.
Just leave
4
it.
years. This is also part of the story. Can everybody hear me all right? Okay. 4 years later, he met fellow attorney Bob Frank for dinner on Chicago's North Side. They walked around the area. Stopping at shops along the way, Harris was impressed that Frank was friendly with many of the shopkeepers. He had not seen this kind of camaraderie among businessmen since moving to Chicago and wondered if there was a way to channel it, because it reminded him of growing up in Wallingford. The thought persisted that I was experiencing only what happened to hundreds, perhaps thousands of others in the great city. I was sure that there must be many other young men who had come from farms and small villages to establish themselves in Chicago. Why not bring them together? If others were longing for the fellowship as I was, something would come of it. Harris eventually persuaded several businesses associated to discuss the idea of forming an organization for local professionals. On February 23rd, 1905, Harris Gustavus Lohr, pardon me if I pronounce these names wrong, Sylvester Schall, and Hiram Shorey gathered at Lohr's office in downtown Chicago for what would become known as the first Rotary Club meeting. In February 1907, Harris was elected the third president of the Rotary Club of Chicago, and toward the end of his presidency, he worked to expand Rotary beyond the city. Some club members resisted, not wanting to take the additional financial burden, but Harris persisted, and by 1910, Rotary had expanded to several other major U.S. cities. Harris recognized the need to form a national association with an executive board of directors, and in August 1910, Rotarians held their first national convention in Chicago, where the 16 existing clubs unified as the National Association of Rotary Clubs, now Rotary International. The new association unanimously elected Harris as its president. At the end of his second term as Rotary president, Harris resigned, citing ill health and demands from his professional practice and personal life. He was elected the president emeritus by convention action, a title he held until his death. Harris died on January 27th, 1947 in Chicago at age 78. After a prolonged illness, before his death, he made it known that he preferred contributions to the Rotary Foundation in lieu of flowers. By coincidence, days before he died, Rotary leaders had committed to a major fundraising effort for the foundation. Upon news of his death, Rotary created the Paul Harris Memorial Fund as a way to solicit these donations. Rotarians were encouraged to commemorate the late founder of Rotary by contributing to the fund, which would be used for purposes dear to Harris's heart. In the 18 months following his death, the Rotary Foundation received $1.3 million, which helped support the foundation's first program, scholarships for graduate study abroad. So that's a little bit of information about Paul Harris, and I hope y'all look forward in the subsequent meetings to learning a little bit more about him. I would now like to introduce some of the guests that we have today. John Barley has a few guests who I think we have been introduced to, but please introduce them again.
Y'all have already met Joey and Barley, but I also have with me my lovely wife, Mimi, my oldest daughter, Christy, and my youngest daughter, Millie, all of whom are Paul Harris Fellows.
Thank you very much, John. And our assistant videographer, Larry Daly, has a guest.
Heather Burbacher is from the CRM, the City Rescue Mission, and then she's here from Chicago, brand new to the area, and just a great, real hero here in our city. Thank you.
Thank you very much, Larry. At this point, I would like to bring up Alton Yates to talk about the family of Rotary.
Good afternoon, fellow Rotarians. Our birthdays for the last week of July are as follows. Dina Boree Brannon, July 25th. John Barley, July 25th. William Andrews, July 26th. Franklin Beard, July 31st. Raul Sharma, July 31st. We ask for your continued prayers for the Kelly family and for all of our families and friends who are recovering from various illnesses, especially the COVID virus. Thank you. That concludes my report.
Thank you, Alton. And now I would like to present our speaker today, a fellow Rotarian. Jennifer Ryan is the CEO of Volunteers in Medicine, a nonprofit clinic that provides free healthcare for the working uninsured. Jennifer is a fifth-generation North Floridian with a proven reputation in building and sustaining community partnerships with experience in healthcare at the national, county, and hospital levels. In the role of CEO, Jennifer is responsible for providing leadership of the organization's medical operations, program development, staff, and volunteer management, as well as fundraising. Prior to her work at Volunteers in Medicine, Jennifer was the executive director of the Ponte Vedra YMCA, where she directed strategic planning efforts, fundraising campaigns, and built and strengthened relationships for community development and collaboration. Prior to that, she held positions with the Centers for Disease Control and Prevention, Duval County Health Department, Brooks Rehabilitation, and Northeast Florida Healthy Start Coalition. Jennifer is a member of the Ponte Vedra Beach Rotary and the Women's Giving Alliance. Jennifer is currently on the board of Family Foundations and Florida Association of Free and Charitable Clinics, and in 2002 was named Jacksonville Business Journal's Women of Influence. Please give a warm Rotary welcome to Jennifer Ryan.
Good afternoon. Thank you so much for having me. Before I give my talk, I want to start with a little video. I can tell you all about us, but I think our patients say it a lot better than me. And then I'll be back with a joke. Our patients have been through so much. They experience not felt well, perhaps much less. They experience loss. Maybe they're also young. Again, we've seen a lot of our patients through them. We've also seen our patients step up, where they take in charge of them, where they might have gotten a promotion, but really took that step out to improve their life, to become a leader of the family, a leader of the job, and then love throughout everything we've seen. Volunteers in Medicine was founded. So everything we do for the clinic is really to do that role and to provide that service and care and compassion. I have a brother that was over 41 and just died of that chill from heart attack. Maternal grandmother, heart disease, due to complications from diabetes. And another one that not so long ago had some COVID. I have had a lot of loss of family due to that. So when I initially came to volunteer, I was really good time. They did my physical assessment and determined the path that they were going to get me back to good health. I initially started just wanting to lose weight, but it turned out they had their whole lifestyle and just lose the weight and be okay. I joined the gym, turned my health around, and I do a lot of cardio, and I do some weighting. I stopped eating out and started cooking my own food. I eat a lot of veg. I work at the hotel where I distribution. I'm important about it. I'm it's a work in progress, but I'm on the right track.
I'm doing pre-cancer. This is before the foundation. So manholes, underground, anything like that. Take it here. Really good at this job. Training people. When he looks at like a piece or building anything like that, I don't think she really goes, too much into stressful thinking about it. And he teaches other people that as well. I just agree with the one that come in. I just blueprint.
And I tell them what we do as far as setting up. And then we're gonna accomplish with that. So, when my company come on 20, everything I'll be doing.
Leadership qualities that really shows, isn't really putting stress on a whole lot of people. I think she makes it easier to work, in my opinion.
But no, it's fair. Man had guessed my weight, and guessed my weight. It wasn't the same weight. And I've been suffering for long. I had dropped 20 pounds in less than a week. When I go to lunch, I was sugar was 500. That's when I found out I had diabetes. And the doctor was a doctor that volunteered at Life of Medicine, and he said, this is gonna be expensive. And he told me about this whole life. Volunteer medicine helps me out with that. Giving me free medicine, free needles, and a free week break so I can check myself and see what my sugar is. More, it's not a doctor though. More like home. It's just like you belong.
But like, every day I see Greece, he lives, his normal life, lives, still living his life to the fullest. Can't really tell that he has diabetes, as he told me.
Every year. I go to here at the school at the cost was $8,000. Much for me on my road. I don't know when for the internet and found here. I need an appointment for me. And I go down here. I see Dr. Philly. And then she an appointment with Dr. Which I was good. And the third was not needed right now. Stop with the portrait and she's your president. She tends to listen to you when you're talking, and sometimes I stop, and then she talk about it more and she'll tell you what's going on. It was for COVID that Dr. Philip, a very big love. After that, there's a lot of love from the staff. Oh, they're so awesome, awesome, awesome.
Healthy person. Yeah. I love it.
There's a lot of them here.
I don't know where I would be. With my dad.
Stay my life. Yeah.
I've seen that video like 100 times and it still gets to me because they're real people and I see them in our lobby. They're our patients. So we are a free clinic for the working uninsured. We were founded, we're getting ready to celebrate 20 years. We were founded in September of 2003 by a doctor, Dr. Jim Burt and Dottie Dorian, a nurse. It was their idea. We are part of a national volunteers in medicine model. So there are other free clinics like us around the country. But we provide primary care and specialty care. We have a clinic downtown and we have one not too far from here on the campus of Inspire to Rise, where we provide just primary care 3 days a week. We utilize volunteer doctors, nurses, our front desk staff, our qualifiers. We provide primary care, and all of these are the specialties we provide. We partner a lot with We Care with Meredith here. I see some friends in the audience. So we do partner with them and speech and hearing. But we can do all of these under one roof, utilizing volunteers. It's amazing. We also believe in partnerships, so working with others. St. Vincent's Ascension does our labs for our patients. Mayo Clinic will provide breast cancer treatment for any women that that are diagnosed with breast cancer. You cannot do this work alone. We also utilize Vision is Priceless to help with our vision screenings for our non-diabetic patients. But it is crucial to work together in this community. And all of the nonprofits really are very collaborative. These are the people that we serve. Really, to be a patient with us, the qualifications are you have to be working, but you can live anywhere. We're not just focused on Duval County, while a majority of our patients do live in Duval County. We only see adults, and we are trying to fill a gap where we don't want to duplicate. So a majority of our patients are in that 45 to 64. Once they turn 65, they qualify for Medicare. So you see that a majority of our patients are the 45 to 64. I can say this because I think we're all over, most of us are over 40, except for the grandchildren. But what we see is, people can kind of get away with not going to the doctor until they hit 40. And then it's like, oh no, I don't feel good. I put on a little extra weight. It's time to get that screening. So that's why a majority of our patients do fall in that age range. Our patients to qualify for our services, you just have to work 20 hours a week, and you can make between 13,000 and up to 250% of poverty, which this year is around 33,000 for one person. Then as you have more family members, you can make a little bit more, and we will see the person that's working as well as members in the household. So we could see a spouse that maybe isn't working. It's just per family. This is just a breakdown of where a majority of our patients come from in Duval County. And this is from the ribbon cutting. We, in June of 2020, during the pandemic, opened up a clinic on the campus of Inspire to Rise. We were very excited about it. It provides primary care. So 32210 is where a majority of our patients were coming from. It also has the highest emergency room utilization, which is our big purpose, is to keep people out of emergency rooms. They're very expensive. And so we thought providing a resource in a community center where people are already gathering. And so we're seeing an increase in our patients, and we're really proud of that partnership. We are moving. We need more space. We are currently in about 6,400 square feet. We're moving to almost 10,000 square feet at Phillips and Emerson in an area that's convenient to other nonprofit partners that we have. So we're really excited about that at the end of this year. And one of the really cool things we're trying to do, in addition to having a pharmacy, having more exam rooms, we really want to do something cool with our meeting room so that it can be, now that through the pandemic, we're utilizing telehealth a lot more, we're doing a lot more. You're using Zoom in addition to in-person. So we want to have that flexibility where we could have groups, but perhaps the leader isn't necessarily in Jacksonville that's leading the group, yet you still can provide support to each other. Having community meetings in the room, having Zumba, yoga, just different things that our patients need outside of just medical care. So we're really excited about this. One of our partners is Feeding Northeast Florida. For our patients that are diabetic and hypertensive, we will give them a prescription for free groceries every other week. And so Feeding Northeast Florida brings their corner market to our clinic every other Saturday. And our patients that have been prescribed healthy food go through with a shopping cart and leave with a week's worth of groceries. It's a nutritionist is with them while they're touring. So we're really proud of this because we do believe food is medicine. What you eat does impact your health. And so this has been wonderful for our patients that just can't afford having all these healthy fruits and vegetables every week, because as we know, costs are going up. So very excited about this partnership. Libre, we purchased Libre for our diabetic patients. It is very expensive out of pocket. but we're very thankful to have received some support from funders to do this. It is about $100 once a month. You have to get it changed out. But what we're finding is not only is it helping our patients manage their diabetes, they're losing weight because they can directly see, okay, I just had 2 pieces of pizza. My blood sugar, it went really high. Then they just have 1 piece of pizza the next time and they see that their blood sugar is better. So in turn, they're eating fewer calories and being more healthy. So it's been just an unintended consequence that we didn't even realize, a positive consequence. We provide preventative screenings. We know things are super expensive if you wait too late in someone's, whether it's in various forms of cancer. So we want to provide those preventative screenings. So we provide Cologuard for all of our patients. And if they are identified at high risk, we can partner with WeCare to get for them to get a colonoscopy if they need. But we will cover all of that. It's very important for early detection and those things. Breast cancer, we pay for our patients that don't qualify for the state funding to get free mammograms. We will pay for that for them. But we want our patients to get the same high level care that you and I get with insurance. So we're really good at managing chronic illnesses. These are things that if you don't take care of your diabetes, hypertension, asthma, you will end up in the emergency room, but they're all manageable. So that is the majority of what we see in our patients. We're also helping save the system money. I think this is a low level, but an average emergency room visit costs $1,800. We have roughly 2,000 patients in our system. If they all went to the emergency room just once, that's over $3 million that it costs the system. We can operate with, our budget is around 1.5 million. The rest is we get roughly 3 million in donated services from our volunteers. So we can operate for every dollar we get, we can provide $3 worth of care. And our average clinic cost right now for one visit is around $250. So we're helping save the system. We're helping people be healthier and keeping them out of emergency rooms. Are there any questions?
Yes, Jennifer, thank you for that presentation. You are correct, as I'm a year away from 40, my body doesn't perform like it used to. I'm going to come around with a mic for anybody who has any questions. Please wait for me to get over there to help the people on Zoom. Okay, Josh Harrison.
Thank you. Jennifer, it's good seeing you again. Congratulations on being CEO of this great organization. 2 questions. 1, you told us you would tell us a joke and you didn't. 2, the age ranges of your participants, and you said you take care of the whole family. I was just wondering what happens. I guess, is there a pediatric outsource or option for those kids of the families that may not be catered to how you're set up?
So I'll answer your second question first, and then I'll tell the joke. So in the state of Florida, we have a universal child care or health care for children called Kid Care. And so if a family comes to us or they are covered under Medicaid, so it just depends on the family situation, but we will refer them to Kid Care if they have children. And so children do have coverage across the state. And my joke, what did the grape say when the elephant stepped on it? Just a little wine. It's a total dad joke. We're into the dad jokes.
If you'll follow me to the center of the room, Mary Pat has a question.
Thanks for being with us today. When I was fortunate to receive the tour of your facility, one thing that struck me was the pharmacy. Can you share with the club how you provide the free pharmaceuticals?
Yes. So everything is free to our patients. They don't pay a thing, including prescriptions. So we have volunteer pharmacists that work in it's called a dispensary, and they help to provide prescriptions for our patients. We pay for a lot of them out of grants and donations. We also get donations from Direct Relief, which is a nonprofit organization that gives out grants, but also works with like CVS or Walgreens when they have things, or Publix, things that are going to expire in like 6 months. They don't want to keep those. So they donate them to Direct Relief, and then we can get sometimes really, really expensive medications that are so good for our patients. But our patients sometimes can purchase like the $1 to $8 prescriptions. So we keep a formulary of those. We don't purchase those, but we do. And non-narcotics, we don't have any pain medicines. But it does help our patients tremendously. Good question. Thank you, Mary.
Question on the left side of the room.
It's not a planted question, I promise. No, it's really just to speak to the experience that I've had working with Jen in partnership with her at Community Health Outreach. And I wanted to point out that it's a true safety net consortium of clinics throughout Duval County that helps meet the needs of over 108,000 uninsured residents. And Jen's work is critical to that meeting that need and being part of that safety net. So thank you, Jen, for all your work.
Well, thank you for all your work.
And into the direct center of the room, Joe Springer has a question.
This is actually coming from one of our Zoom members, and they were asking, if you didn't know you were here, how would someone find out you're here? How can they get in touch with you? Do doctors refer it? What's the deal?
So great question. Thank you. It's any way that people can find out about us, but a majority of it is a friend tells them they're at work. We're trying to really get to employers to really help them see the benefit for all of their staff. We recently had a woman who owns a cleaning business. She's been sending all of her staff here, and she is ecstatic because they're not taking off sick. They're working, and people want to work. And so it's employers telling them, it's their friends telling them. The most interesting thing about volunteers finding out about us, it's through friends. But a lot of times, because people come tour through that want to volunteer, and I'll ask them, how did you hear about us? They just Googled volunteer opportunities. And I think we come up because volunteers is in our name. So we are one of the top search results. But we always need more. We need more people to know about us. We're not at capacity. We're not in a waiting list. We have a director of volunteers. If anyone wants to volunteer, you can let me know. But we have someone that helps, and we're always looking for volunteers. And it's not just doctors and nurses. It could be, helping out at the front desk, which to me would be the most fun because you're the one that gets to provide them with their welcome and hello and smile. But please help us and being able to come talk and share our mission with you. Hopefully you'll know somebody, it could be someone at a restaurant. It's someone that does our hair, someone that cuts our grass. All those people need healthcare, and they probably don't have it right now.
Yes, we have a question back towards the door, and Gigi.
Hi, one of your patients was walking into Planet Fitness. So in addition to food and the dispensary, do you also prescribe, exercise, or do you have an agreement in place with Planet Fitness?
So she actually volunteers at Planet Fitness. So the video, we're really trying to get across that these are people that are working and but they wouldn't let us go inside. But we got her going in. So she works out there, but she also volunteers there. But I've been talking to the Y because they have a exercises medicine program that we're trying to get some grant funding for so that we can then send our patients, because Ys are all over the place. And so we're trying to either the Y get a grant or we get a grant. But you're exactly right. It is, food is medicine, but exercise is medicine as well. So we're working on those partnerships.
And over towards the door again, Drew has a question.
You talked about a new facility that you're opening over off of Emerson. Is that going to be to see patients, or is that going to be a corporate office? Are you going to close the one downtown? How does that all work?
Good question. We will be moving our clinic operations to the new location. The land we're on is for sale. We're Salvation Army has a couple lots for sale downtown, and we're one of them. And we've known it, we needed to move at some point. So our goal was to stay within 5 miles of downtown, but we'll be moving everything there. We'll still have our West Jax clinic at Inspire to Rise though.
Do we have any more questions? One more question, Gigi? Or you can tell me.
The question was around transportation. How do patients get to us? So our patients they're going to work, so they have to have some form of transportation to get to their job. So we're convenient to a bus line. We have on-site parking. And when we call to confirm the appointment, if the patient says I can't come and they answer that it's because of transportation, we have a relationship with Uber. So we will pay for their Uber to get to and from whether it's a referral that we send them to, or to come to us or to West Jax, we'll pay for their Uber ride. Because you're right, transportation is a huge issue in our community.
One more question, Scott.
You talked about vision is a big portion of what you do. For those who do need cataract surgery, obviously you can't do that in your clinic. Does St. Vincent's or Baptist, whatever, give you the facilities, or do you do it in an outpatient center? And how is that done?
For vision, if we need, Meredith, does WeCare do cataract surgery? So we partner with WeCare, where Meredith works. They coordinate specialty care in doctors' offices. One of the nice things about us is once a doctor retires but wants to keep his license, we can provide the facility for them to continue working and provide a specialty. And WeCare coordinates with people in their offices that will donate maybe one cataract surgery a month. And so we coordinate with WeCare. So we do have and like Meredith said, all the safety net free clinics work together. So we all try to figure stuff out. But if there was absolutely nothing we could do, I would go to a donor and ask, could you please help us with this particular person? But WeCare, we have a great system.
Okay, well, I think that's all the time we have questions for. Jennifer, Ryan, thank you so much for joining us.
Thank you.
and
Best
speaking to
questions
us.
ever.
And on behalf of the Rotary Club, I'd like to present you with this gift.
Thanks so much.
Great. Thank you so much, Jennifer. We really appreciate you being with us today. And more importantly, we appreciate everything your organization does for our community. So thank you so much. Y'all please join me in another round of applause for Jennifer. I also want to thank all of our visitors and guests today and congratulate our newest Paul Harris Fellows. And I also want to thank the person that loves them greatly and made that possible for them, your grandfather, John Barley. John, thank you so much for being such a great, setting such a great example, both for your family and for our Rotary Club, for the members of our club. So thank you. Thank you for all you do. And thanks to all our members who participated in the meeting today by virtue of your attendance, either virtually or there in person at Timuquana. Thanks to our team that puts the meeting together, our AV crew there, Joe and Larry, our front desk group, Patty and Stu. Thanks to Marshall and Ron and Alton and Mike and Carter, everybody that participated in making the meeting work today. So thank you all so much. We look forward to seeing everybody back at Timuquana next week. Let's see, before we close, I'm going to ask Mike Crumpler to lead us in the 4-way test. Mike?
Other people read it. Yeah, I'll definitely do that. And there's this book. It's pretty interesting.
Is that a wrap, guys?